This is Dr. Andrew at St. John's, and we wanted to spend a few moments discussing the possibility, safety, and feasibility of returning to a yoga practice after a hip replacement. And this has really become a big deal in the past 10, 15 years because the enthusiasm for yoga now extends well beyond young and healthy to older and more arthritic patients. The physical practice of yoga itself has a series of very challenging upper and lower body postures for strength, balance, and flexibility. And with age, at times, these poses can become more uncomfortable and difficult with worsening hip arthritis. There's weakness, stiffness, and pain, which necessitate a gradual compensatory modification or even complete cessation of the yoga practice. And so ultimately, losing the ability to enjoy yoga, to practice yoga, can be a motivating factor to seek hip replacement in many patients. However, whether or not a return to yoga after total hip replacement is safe, advisable, or even possible is currently under debate. A major concern after total hip replacement and the practice of yoga is the potential risk of dislocation. Conventional hip replacement of 10, 15, 20 years ago had very strict precautions to guard against positions of risk, often limiting hip flexion, extension, adduction, and rotation. However, common yoga poses often put the position of the hip far beyond those identified boundaries. In a motion capture study, volunteers with diodes placed around their body parts were noted to have hip hyperextension far greater than 30 degrees in a lunge, up to 109, 110 degrees of flexion in pigeon, 22 degrees of rotation in warrior 2. And so the surgeon's role, therefore, is to balance all the demands of a patient's hope to return to yoga after total hip against the risk of a dislocation created by the extreme hip positions that are part of the discipline of yoga, or the practice of yoga. And so we embarked on our own analysis of patients who had undergone hip replacement and were practitioners of yoga. So we recently published a paper on returning to yoga practice and teaching after total hip replacement. And we looked into this specifically because current recommendations by orthopedic surgeons regarding yoga are really evolving. And most of those recommendations come from surveys of surgeons based on personal preference and community standards. And these recommendations to either participate or avoid particular activities like yoga are made with only theoretical or cursory awareness of what actually happens to the body during yoga. A survey by the American Association of Hip and Knee Surgeons did not even address the topic of return to yoga. So in our office, we decided to retrospectively review a group of patients between 2010 and 2019 who self-identified as yoga instructors. So specifically, these were patients who practiced yoga and had years of training underneath their belt. We did not include patients who practiced yoga but were not teachers. Surgery was performed with a direct anterior approach, a total hip replacement, and we specifically looked at medical history, complications, reoperations, rehospitalization, and the return to yoga and return to teaching. So the findings were very encouraging. We evaluated all patients about return to yoga, return to teaching, and their fluency with 14 specific poses identified in an earlier orthopedic surgery study. And number one, we found that all patients were able to return to teaching yoga. Now, interestingly, we had cautioned all patients to refrain from yoga for the first 3 months after surgery to allow the tissues to fully heal. But it turned out many patients, the average time to return to teaching was 2 months. And the instructors explained that they could begin teaching class well before needing to participate or demonstrate poses. And the main motivation were financial considerations. Finances were described as the main motivation for an earlier return to work. The second major finding was that all patients were able to return to their own practice of yoga. Among these yoga instructors, the mean time or the average time to returning to practice was 2 months. Interestingly, despite the recommendations we made to the contrary, to wait until after they completed recovery. We specifically examined 14 specific poses. Some were seen on the previous slide, some are seen on this slide. And we asked these yoga teachers to describe their ease or the level of difficulty when doing these poses. And it turns out about nine patients, or 64%, were able to do all poses without difficulty. 5 had some difficulty with one of 4 poses: twist, pigeon, half moon, or warrior 1. And those who reported difficulty with certain poses chose positional adjustments to practice an easier version of that given pose. Probably the most important thing we found was the really good advice we received from our yoga instructors about the ability and a return to practice. And in interviewing them, we came across several really great ideas. We listed them on this slide. I'll just pause and take your time to read them. They're common sense, but it's so important to get this understanding, especially from these teachers who have devoted their lives and their careers to this practice. That ranges from, even the first one, adopting a beginner's mindset and starting back in a level 1 class, even if you had been a more advanced yogi from an earlier stage. So take some time and read through these, and that may help guide your return to yoga. I think the most important thing is for patients to have a very clear discussion about the risks and feasibility of returning to a yoga practice. There are case reports of potential dislocations after a return to yoga. For example, in one paper, there was a history of a dislocation that occurred 17 years after a hip replacement during a shoulder stand, or another in the case of a 90-year-old 9 years after a total hip replacement. And so the concerns are significant, even though the complication itself may be rare and improbable. So in the absence of definitive evidence-based guidelines, we also have learned that it is clear that motivated patients are going to resume their yoga practice. And we think it's therefore very helpful for surgeons to be involved in that process to guide patients toward a safer and gradual return. And I think the importance of this current study demonstrates that a return to yoga in an experienced population, so again, yoga teachers, is not only possible but also safe, and that limitations in performing poses should be understood and modifications should be recommended when needed. The advice from the teachers who have already successfully returned to practice should be well heeded, and hopefully future comparative studies will add to a growing understanding of biomechanics and the safety of returning to yoga. Thank you very much.